MET for the lateral hip rotators, in particular, Post Isometric Relaxation. The lateral hip rotators is a group of muscles who have a movement in common. They all laterally rotate the hip. This includes the Piriformis, the better known of the group, but also Gemellus superior, Obturator internus, Gemellus inferior, Quadratus femoris, and Obturator externus. And you can see through this picture that they all attach into the femur, but they all attach to different places on the pelvis. But as a group, they all perform lateral rotation in the hip. The most problematic, or the muscle we hear about the most, is piriformis, due to things like piriformis syndrome, or people who really get very short, tight, uncomfortable piriformis. It originates on the sacrum and inserts into the greater trochanter of the femur, and its action being lateral or external rotation of the hip. So to stretch this muscle, we want to internally or medially rotate the hip. Normal range of motion when we're testing is about 45 degrees of internal rotation. And we test this with a bent knee so that we can support the client's joints as we test rotation. Note, although we apply MET and we're talking about piriformis here, we're applying it to a direction and action. So actually this MET will have an effect on all or any of those lateral hip rotators. So let's take a look at the technique itself. Although we're looking at the lateral hip rotators as our target muscle group, if indeed when we tested range of motion in hip rotation, we found that our clients were actually restricted on lateral or external rotation of the hip, then we would simply apply this same technique, but in the other direction, therefore accessing the internal hip rotator group. So remember, just treat what your client presents with. Let's take a look at the technique. So I'm just going to test rotation of the hip. Again, this is a difficult movement for your client to perform, so I tend to do this one passively as it's too awkward for the client to test actively. So first of all, I'm going to rotate the hip outwards. So I'm just testing Danielle's external rotation. So foot comes in, but hip goes out. And she's actually got a lovely range of motion through there. Now I'm going to test her internal range of motion, which will see if her external hip rotators are tight. So foot comes out, but hip is rotating in. And she's really, really restricted in there. So, they should both be about 40, 45 degrees. We've got excessive rotation in terms of external, but when we internally rotate her hip, she's only got maybe 10 to 15 degrees. So we're going to go into MET. We find that first barrier. Now when you're ready, rotate your leg into my hand. That's it. 10, 9, 8, 7, 6, 5, 4, 3. Big deep breath in, out, and relax. Lovely. Let that leg go heavy. Beautiful. And once you feel the client relax in that window of 10 seconds, just move them more gradually to the next barrier. So not to that hard end point, just to the next barrier, and hold for 10 seconds. Once that's done, ask your client to rotate into the inside again. 10, 9, 8. So she's rotating her foot toward the wall, hips rotating out. 3, 2, 1. Big deep breath in, out, and relax. Let it go heavy. Beautiful. And once that's relaxed, I'm going to rotate her hip in slightly more. So already much better range of motion. I feel we've room for one more. So after this 10-second hold, I'm going to ask my client, rotate your leg inwards again. 10, 9, 8, 7, 6, 5, 4, 3. Big deep breath in, out, and relax. Let the leg go heavy. Lovely. And once it's gone, simply rotate further inwards and hold the last one for 20 seconds. And simply retest.